Hello, everyone. Today, I want to provide you with some information on what's going on at San Juan Regional Medical Center. We continue to see increases in our volumes overall, and our teams are working extremely hard in their efforts to take care of all of our patient needs. I'm extremely proud of our caregivers that we have here at San Juan Regional Medical Center and San Juan Health Partners. They're really doing great work to try to take care of everybody that comes in through our facility. Currently, we have a census of 169 patients at our hospital. COVID confirmed out of that number is 68. Now we have 20 patients that we're waiting for results to come back on. And we have a total of 10 patients that are on ventilators or intubated here at the hospital right now, and 8 of those are confirmed COVID patients. Our trends seem to be relatively level or even increasing a little bit right now within our community. So we're trying to really pay attention to that, and we're trying to adjust our staffing needs as we need to. Now, one of the things that we follow very, very carefully is what is our percent positivity rate? In other words, of the testing that we're doing, how many of those tests are coming back positive on a percentage scale? We have a little bit of a trend in the last couple of days that show it starting to decline. We hope that that continues, but we've seen that happen before and then it rebounds again. Now let's talk about the vaccine, because that's probably the most important thing that's going on right now. New Mexico Department of Health has launched an enhanced website for the COVID-19 vaccination. This is a way that all New Mexicans can go online and register for the vaccination. Those doses will be becoming available in our community. They're already being administered depending on where you are in the priority groups, and we're going to talk about that here in a second. But San Juan Regional Medical Center urges all of our community members to complete your registration today, as soon as you can. It's vaccinenm.org. So the word vaccine with NM, no spaces, .org, and you can go on there, fill out some forms, and it will put you into the queue based on where you come up on the priority list for the vaccination. We encourage this greatly. All of our emergency physicians, our physicians in general, are doing great with getting the vaccine. And all of our emergency providers here at San Juan Regional Medical Center that are eligible have already been vaccinated. Again, that's vaccinenm.org. And then from there, you'll receive updates. You'll put in your phone number. You'll get text messages about that. And if you need some help with the registration process, the number to call is 1-855-600-3453. And then you'll get some options to, and you'll choose option 0 for vaccine questions, and then 4 for tech support. All right, so it's a prioritized vaccine allocation, and these are based on recommendations that come out of the Centers for Disease Control, or the CDC. So the phases are in place really for 2 purposes. They address keeping functioning of our operations across the organization, across our community, but also addressing the needs of the people who are at highest risk. And so that's how it's broken down. 1A is really looking at all persons who live in healthcare settings, skilled nursing facilities, that kind of thing, or people who work in hospitals or frontline facing positions where they're taking care of patients. 1B is looking at all individuals who are 75 and older, or those who are in frontline work that cannot work from home. And then it works its way down the tier. We've got a graphic on it that comes from the Centers for Disease Control. So please take a look at that and kind of look at how those priorities are going to work out. Again, it's really important that you sign up as soon as possible so that you get in that queue. And as your priority level or in that queue comes up, you'll be notified and you can go in and get those vaccinations. You know, we're all really excited about the vaccine, and it is an incredible gift that we've been able to get that and that we're moving forward. Nonetheless, we all have to do what we've all already been doing. Continue to hand washing, continue to wear a mask when you're out in public, continue social distancing. All of those things are still important so that we're not spreading the disease and continuing an uphill battle. We're doing everything that we can to support our community, and our healthcare workers are counting on you and counting on the community to do their part as well. So please help us by practicing all of the standard COVID safe practices while we get this thing rolled out, while we start the vaccinations, and we're still taking care of patients. Remember, I said that slope is still going upward, and we need to do everything we can to get to the end of the tunnel. We know that there's an endpoint now, but we have to be diligent and we have to continue the standard practices for COVID safe so that we can get to green as a community. Thank you for your support. Thank you to all of the healthcare workers, all the frontline first responders that are out there. We cannot thank everyone enough, but we're going to get there and we're going to get through this.